Hi, good night, everyone. Good night again. Um, yes, I'm Felicia on TikTok. Yes. I'm I'm coming tonight. As I was told, to give a brief. To give a brief about what happened and what led to what is going on now in my situation. Okay. All right. On September the 23rd, 2023. I was having discomfort in my abdomen and my chest, you know. So I go to the Queens Medical Center in Queens, New York. Upon my arrival, my vitals was done, blood test, urine test. Okay. I was told that my blood count was low, a blood transfusion was required, which I went ahead and I get it. I got it. After getting that blood transfusion, the doctor came to me and she said to me that it was going to give me a Depo-Provera injection to stop my period for 3 months. That's like a family planning injection. Anyhow, I went ahead and I took it. After getting the injection, she came back to me like 10 minutes after, a couple minutes after. And when she came to me now, she was asking me questions that I truly believe she should have asked me before I get the injection. Question like, when was my last period, or how old I was, and what caused me to have a low blood count. Mark you, it's not the first time I'm visiting that hospital. Understand me? That hospital have my medical records. You understand me? So she asked me my age, really ring a bell. You understand me? She asked me, why do I have a low blood count? That is not the first time I was told about a low blood count in that same hospital. All right. After she asked me those questions, she didn't stop or wait to hear my answer. So right there was like a second red flag for me. The third red flag that day, upon my release, where she should have signed and I signed, when I asked her about it, she said she don't have to sign the paper. We should have it as proof that the paper that day of my release did not sign. And not only that, I was given two set of paper, two different time. One is 103, one is 1013. Anyhow, reaching home, that was on my mind for quite a while. But the doctor asked me when was my last period. Seeing changes in my body, I was just basically saying that it's from the injection. Understand me, people? Exactly 5 weeks after, I started to spot. The spot getting a little more, heavy and heavier, but not too heavy for me to use a ton load of pads. It was like 2 pads per day. It's like I went from like a panty shield like to 2 pads per day. So, get hear that it could be a side effect from the injection causing the spot. Because that was one of the symptoms, as I gathered. Calling the hospital in the middle of November of 2023, I got to speak to a nurse. I was like calling, I gradually get to speak to a nurse. Speaking to the nurse, people, upon me speaking to her and telling her what I was going through, before I actually even done, I said I done. I didn't get a respond, nothing. The phone get disconnected in my ears. At that point in time, I was saying maybe it's just a disconnection or stuff, but knowing now, I see why that phone was disconnected. That call, should say. In November, the last day of November, I went to the Presbyterian Hospital in Manhattan. That one is in Manhattan. When I went there, it was like minutes after 7 that evening. When I got there, you know, I get to speak to a gynecologist about my symptoms and my situation. Based on what he was saying to me, you know, he was saying that my heart was racing a bit. At one point, he was asking me before they gave me the injection if there was an ultrasound done to see for any changes in my body. Okay, which that did not happen. All right, during our conversation, a fibrosis was mentioned. So I turned to him and I asked him that if it's a fibrosis, can I get something like to shrink it or something? He said, you're already on the Depo-Provera. That should stabilize the bleeding, stop the bleeding, if it was of a fibrosis. But at this time, he gathered that a DNC would have to be done. He asked me, do you know what a DNC is? I told him no, because I'm not going to be ashamed and embarrassed to tell people that I never know, because I never go to a procedure of a miscarriage or an abortion before. I did not. So what happened that night after examination and everything, he told me that he didn't feel a large fibers or nothing. People, I got that recording. You all can listen if you want to do so. What happened was they gave me a pill. I can say now I got an abortion pill. Okay? I was actually miscarriaging, losing the child based on the injection. So instead of they gave me the DNC as that was required that night, you know, it's best for me to get, I was given an abortion pill. I did not know that I was pregnant at that time, because that wasn't told to me. You understand me? I did not know. So what happened was, he told me that my blood count was also low that night. So blood transfusion again was required. Before I get the blood transfusion, I got the pill. People, after getting the pill, like a couple of minutes, going up to an hour, it's like I was having a child. This pain just come on me. Not only that, I could feel I was actually peeing myself up when it was all blood. Okay, not going into too much detail, I just want to explain what really took place. After seen by 5 gynecologists that month of November, between the 30th of November to the 21st of December, no one told me about the pregnancy, people. I was only given the pill to finish expel it. You understand me, people? I almost bled from that November the 30th, people. I had was to get 3 units of blood in 21 days time. Okay, 22 days time. I was actually bleeding my life away. Nobody tell me about the pregnancy. Nobody told me about it. I was given an abortion pill to finish expel the pregnancy. Nobody tell me that I was pregnant. Understand me? After doing an ultrasound in my Maimonides and one in Kings County, nobody told me that there was a pregnancy. Until 1 month after, when I started throwing up, actually puking up, I was having gruesome pain, discharge. When I go to the Jamaica hospital on the 26th, understand me, of January, that was when the pregnancy was mentioned to me, and I was told that I was badly infected. Okay, people? Started to get the antibiotic in the Jamaica hospital. I was told to make an appointment soon as possible to see my primary care doctor, which the hospital that gave me the injection, that was where my primary care doctor was. Okay? Calling to make that appointment, people, I was told that I cannot see the primary care doctor based on my immigration. Not now, based on my insurance status. I was only able enough to see in the emergency room. This happened last year, not this year, last year, January. So with that, people, I was in this emergency room suffering here in New York, crying for pain. People, no hospital wants to treat me. All they were giving me was appointments, referrals. And when I called to make those appointments, Kings County gave me the first appointment to see the obstetrician / gynecologist people. When I called to make that appointment, I was told by the operator that they cannot find nothing in the system about me going to Kings County. Okay? So I've been living untreated up to this day. I left New York in July in search of medical care. You see? And that report, the doctor stated that I should remove my uterus. And at the very least, a biopsy should be done on my endometrial. He told me to search for any form of infection. Coming back to New York with that referral, people. Seeing the doctor less than a month before that referral, I was given again a referral. When I called, there's no appointment. I'm here suffering. I was to leave New York again in October. 8 days after leaving New York, I was in an hospital in Florida, people, undergoing treatment for sepsis and blood clot. I was in a hospital room every month. People crying for pain. Nobody wants to treat me. After I was told after pregnancy and I was badly infected. Okay? Nobody wants to treat me, people. Nobody. You understand me? Right now at the middle of the night, my feet are in flame. See it here, people? See it there? My foot, them people, they are in flame, changing color. See the people? Changing color. My feet are actually changing color. My feet are actually changing color, people. My organs inside of me are enlarged because of this infection. I'm here suffering in pain. The funniest thing, upon my arrival in Florida in search of medical care, you understand me? I go to the Burwood Hospital first. If you see those poor people, I was sent away crying to them that I can't breathe. That is how I end up in Tampa, Florida, people, from Fort Lauderdale, in another ER room, undergoing treatment for sepsis and blood clot 3 days after Burwood sent me away. When them asked me where I was coming from, and I told them that New York, I was sent away, crying to these people, telling them that I can't breathe. Okay? Only given 5 days of treatment of sepsis and blood clot in Brandon Hospital. I know that New York stopped them from treating me. Stop that treatment. And the reason why I'm saying that now, after I was released from the hospital, from Tampa, that is Brandon Hospital, on the 10th, New York Department of Health texted me on the 11th, telling me that they want to see me in a business meeting. Okay? Never left Florida same time, because not only that I was released from the hospital without no medication. I was given one pill, one antibiotic pill in a bottle After the doctor tell me that I have a clot in my right lungs, everything me I tell people, me have proof. Okay? Coming back to New York here, people, me go to 4 hospital. Nobody no want to treat me. Nobody don't want to treat me. One of the hospital me go to, showing them my referral, I was sent to the psyche hospital. People, luckily, what I was saying was true. The psychiatrist, when I reached here crying, after me call the ambulance to take me to the emergency room. On the 11th, I was in pain. The 11th of December, I was sent to a psyche hospital. The psyche hospital refused to keep me because they see it in the system where I was really septic for true. Going back to the hospital that day, twice. In one day, them send me to the psyche hospital, and the psyche hospital said them not gonna keep me because I'm not for their care. It's in the system that I'm sick, and it's not for their care. I'm here suffering, looking out in the people. Since I come back to New York, I go 4 hospital. I call them name, I go. The first one, I have to go look at my paperwork, but I know the second one was Lincoln. The third one was SBH Hospital. The same hospital will give me a referral on the 14th of August for internal treatment, obstetrician/gynecologist immediately. That was the hospital who sent me to the Meadows on the 11th of December. Okay? That was the third hospital. The fourth one was St. John's. That was the doctor now who told me that, like they never find what is going on yet. So after I do my ultrasound and everything, that doctor told me that my liver, my endometrial is over 7 centimeters. My kidney is infected. All of that them tell me the 16th of April of this year, no treatment. It's like when the doctor asks me, weren't you going to your doctor? Weren't you seeing doctor? I tell him yes. And this time I get them start to dig that night. So what they did now, they let me do a second ultrasound. On that ultrasound bed, the phone ring in that room, and what I heard the lady said to whosoever she was talking to, why should I delete the first ultrasound? Okay? No treatment. Me and go people. If you have infection in my body from 2023, no treatment. What happened now on the 19th? I get to go to a urgent care. When we got the urgent care, people, the urgent care, she could see large amount of blood and protein in my urine. We start get antibiotics same time, and something from my kidney, because it started Flomax. They said it's from my kidneys a treatment. Going back for a follow-up on the 28th of August. The doctor put it in writing. Without treatment, that could cause harm to my body. Going to St. Joseph Hospital now on the same day, because I get a referral to go to the hospital the same day. The doctor said they cannot treat me. The hospital have to treat me based on what is happening. Me going to the hospital, the emergency room will tell me, say, my kidney and my bladder are bleed. Send me back out. If you're going to make appointment, if you see family doctor, that's all them have me here. These people definitely want to see me die after a miscarriage. Them give me abortion pill for wash it out. Them not clean me out, nothing. My organs are now enlarged. I was told that my uterus, there's no ultrasound can take from my belly, because my uterus is actually covering my organs at this time, people. And these people are refusing from treating me. They are refusing from treating me like that. It's like they're literally waiting for me to die. Please make this video go 100 million views. You understand me? Share, people. At this point, everybody are going to die one day. So I'm not scared. What I'm scared for, I feel them get away for what them do to me. at this point. So I beg enough to share. And everything I'm talk said, there's a proof behind everything I'm saying. I was given the pill while I was pregnant, and they tried to cover it up by not treating me, causing my organs, them knowing my body for enlarge people. Me can hardly walk on my belly heavy. My belly is heavy. And they're refusing peeing up myself at times. Seeing blood with a naked eye in my urine. And they're refusing from treating me. Okay? Please share and pray for me. Anywhere in the world in a day, me I beg you now. Because a prayer keep me this far, people. And by me coming on TikTok, people, I tell them I must drink. I must rub on my foot and all these things. My feet are in flame, changing color. When I go to the hospital and I show the doctor them my foot, them people, I show them pictures one at a time. What is coming out of me, they don't want to see nothing. Literally, they don't want to see nothing. You understand me? Me they in a pain. No form of medication, people. I'm on. None. Please, please share this video. I'm begging you all.